Hi, I'm Dr. Crapo. I've been in practice since 1980. Two major events. When I was a young boy in about 7th grade, I came home from my health science class and being very excited about how I'd done on an exam, my mother said, "So you're going to be our doctor." And from there on, I was going to be your doctor. Another, when I was a young adult, sort of an epiphany, an inspiration, I guess, that changed from being an MD to a dentist. Well, what I enjoy about being a dentist is changing people's minds. That's the most exciting thing for me. As a child, I hated the fear, the pain, the anxiety that went with a dental appointment or visit. And as an adult, as a dentist, I've found a way to fix that. Well, this is a big question, actually. It ranges anywhere from headaches to cancer, but maybe something topical at this particular time would be dry mouth. We're seeing people live with high blood pressure, diabetes, high cholesterol, and the medications for these things oftentimes cause dry mouth, and with dry mouth, a higher incidence or rate of dental disease and caries or decay. So when you're consulting with your doctor, when you're on these medications, make sure you see the dentist as well so that these kinds of things can be addressed. Well, first of all, I love dentistry. I've loved it right from the beginning, and so I'm always reading, always wondering, is there something that's really relevant that's going to help both me and those that I serve? But on top of that, I spend hundreds of hours in continuing education every year, from reading to video to masterminding with colleagues. And on top of that, I keep in touch with leaders in the field, leaders in dentistry, by way of phone and letter and so forth. So that's how I keep on top. Oh, the biggest challenges in dentistry for me are probably communication with my staff, communication with the patients to help them understand their needs. And maybe a corollary to that is wanting to be all things to all people. This really puts a lot of pressure on my staff and on the schedule each day, and sometimes the line between wanting to help everyone and truly helping everybody is a fine line, and sometimes in my overexuberance it'll be stressful for the staff and hard on the schedule, and sometimes leads to a hurried look. Okay. Oh, I think the things that make us proud in the office are when we hear back that the experience has been painless, that they're delighted with the care that they received, transformation of lives, when people have to do something major in their mouths and it transforms them. The comfort, the beauty, function, those are wonderful. And then being involved in a person's life when they go through these things, helping somebody get what they want, helping somebody in their own happiness, that's about as good as it gets. Oh, there's lots of stories. Maybe not a particular story that, one of the things that I'm surprised about is that our senior citizens get as excited about beauty as our younger patients. And that's been a real surprise to me, that 60, 70, 80-year-olds love white teeth, love to look good, and love to feel good about themselves.